This point with water and alcohol, actually there's a big thing about water and alcohol which I discovered rather the hard way years ago when I made up, we did an experiment, I had to go and make the homeopathic medicine myself, which happened to be Plumbum metallicum, which is a real pain in the arse to make. Believe me, you have to grind it for hours, it's insoluble. Anyway, I wanted to make, we needed the water alcohol mixture, I think, you know, so I just went and got this, you know, 100 milliliters of water, 100 milliliters of this double distilled deionized water, 100 milliliters of, you know, the very highly purified alcohol. I was just about to mix, and these ladies came rushing up to me and said, this was in a lab in France, they looked like the tricoteurs, you know, those ladies who used to sit on the guillotine while people were being executed. They said, no, 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 you can't do that, monsieur. If you mix 100 milliliters of pure water with 100 milliliters of pure alcohol, you end up with about 180 milliliters. You do not end up with 200 milliliters. If you want to make a given volume of a given concentration, you have to look, well, in those days, you had to look it up on a table. Now I'm sure you do it, you know, you have a little program that does it. So there are, you know, big interactions between water and alcohol. Anyway, that's completely off the point. I'm going to start really from the opposite end from Alex, which is the very pragmatic, very practical, very social, but we will end up quite close to where Alex left off, and also there's some stuff very relevant to the meeting, to the session after lunch about the economics of homeopathy. So anyway, so first of all, very pragmatic, who uses homeopathy? So this is recent, very interesting, high-quality data from Harvard, based on the, where is it? This state, this thing, the federal. How do I make this thing work? Oh, wait a minute. How does the point? Do I have a pointer here? The green. Oh, no, it's not. Oh, never mind. Based on this federal survey, this is a national survey done in the States, looking specifically at homeopathy. It's quite small use in the States, 2%, just over 2%, that's in 2012. 15% increase, more female, healthier lifestyle. Not very surprising, but this is good quality data from a prestigious center. And it is perceived as helpful. So this is a huge table that goes on for 3 pages about the demographics of the users. Just one thing I really want to draw your attention to. This is educational level, greater than high school education. So this is the homeopathy group, 85% versus the whole population, 73%. So, and this pattern you see again and again. This has now been shown in the States. It's also been seen in France and in Germany. People who use, well-educated people use homeopathy, and women, of course. So this is just the perceived usefulness of homeopathy. So homeopathy, particularly when prescribed by a practitioner, is perceived as more helpful as self-purchased homeopathy, and also more helpful than supplements. And more helpful than acupuncture, similar to chiropractic. So this is a very large study done in France, the EPI-3 study, over 6,000 patients, with 4 different cohorts, musculoskeletal, upper respiratory tract infections, sleep disorders, and anxiety and depression, looking in terms of clinical benefit, medical care costs, adverse effects, loss of therapeutic opportunity. You might wonder what that means. It means, do people commit suicide when they're waiting to have effective drugs for their depression? The answer is they don't, and actually they're more likely to commit suicide if they get the so-called effective drugs, but never mind. Anyway, so this is just to show you the flow chart. So you have over 6,000 patients treated by over 800 doctors in French primary care. And this is done by the University of Bordeaux. And 3 groups, so you have conventional GPs, mixed practice GPs, and homeopathic GPs. And so that's just to show you the numbers, and also the distribution of use. So less used, homeopathy is relatively less used for cardiovascular disorder, but relatively more used for anxiety and depression, osteoarthritis and joint disease, and upper respiratory tract infections in the top 4. And healthier lifestyle, but no big difference in comorbidities or quality of life. The groups in that sort of crucial area are actually comparable, healthier lifestyle, and much more positive attitude to participating in self-care. And the people who wrote this did raise the question, is this where does the directionality flow? In other words, do the patients go to the homeopaths because they're more interested in self-care, or do the homeopaths encourage them to use self-care? And that is not clear. That needs further investigation. And again, there we are, higher education. So above high school, 47% compared to 37, and lower. So again, higher education, healthier lifestyles, less likely to smoke, less likely to be overweight. And so basically, similar progression. So this is musculoskeletal, similar progression, but half the use of non-steroidals. This is a very dangerous class of drugs. So same results for much less drugs, much less dangerous drugs. So this is just to show you. So this is in the acute situation. As you can see, 102 in the homeopathic group, 63 in the conventional medicine group. Sorry, other way around. Sorry, in the 102 in the conventional, 63 in the homeopathic. And an even bigger difference in the chronic situation. Much fewer non-steroidals, also fewer conventional analgesics. But a big difference, just about double, just about half, if you like, the use of these dangerous class of drugs, non-steroidal anti-inflammatories. Again, rather similar thing for anxiety and depression. Much less psychotropic drugs, much less actually. Again, roughly half, for slightly better results. Oh, what's this? Oh, let's skip that. Sorry, we've got to. Oh, again, just. Yeah, and this is just to show you. So that's the homeopathic group with the here at the top. Sorry, I don't have a pointer. This is. Oh, sorry. Yes. Oh, there it is. Sorry. So that's the homeopathic group. This is the conventional group. So progression similar for many less drugs. Half. Psychotropic drug use, you can see big difference in the use of psychotropic drugs for results which are actually better than conventional, although not better than mixed practice. So that's, yeah. Oh, let's skip. This is okay. So this is another study. Also, no, let's skip that one. So this is another one, also done in France, looking at homeopathy versus antibiotic strategy in children with recurrent respiratory tract infections, at least 5 a year. Children aged between 18 months and 5 years with at least 5 episodes a year. And these were GPs with homeopathic orientation. The French are very regulated. You have to have a diploma. 500 followed for 6 months. And they looked at various outcomes, including quality of life. This is actually the parent's quality of life, not the child's quality of life. And anybody who's had a child with otitis media knows it has a pretty bad effect on your sleep. So it's superior in all respects. For the cost the same. Confounders, including smoking. Smoking, we know, predisposes to upper respiratory tract infections in children in smoking households. And the homeopathic group were less likely to smoke. So that is a confounder. Daycare was the other way around. The homeopathic children were more likely to go to daycare, which actually also predisposes to upper respiratory tract infections. So that cuts the opposite way. Comparative effectiveness in Germany, this is work from Claudia Witt, looking in this very sort of bread and butter stuff for general practice, homeopathic versus conventional GPs, long term, up to a year, and quality of life. And basically they looked at the direct medical costs and the indirect costs, the so-called societal costs. So this is the result. This is one of the results in terms of the SF36 quality of life score, standard element for measure of quality of life. Statistically highly significant, particularly in the first 6 months. As you can see, the homeopathic group was, we had a ceiling effect here. They just about got back to normal. There wasn't much scope for further improvement in the second 6 months. So, and this is the children, not actually statistically significant, but they started off worse and ended up better. So, better outcome for similar cost. But there is actually the cost thing, there's another story which I'm going to tell you about in a moment. This is the Swiss Health Technology assessment, as a result of which homeopathy is now recognized in the Swiss compulsory medical insurance, just to show you various kinds of, biggest single kind is individualized homeopathy, but also complex and French style clinical homeopathy. 6 out of 7 showed comparability to standard treatment. The one exception, but this rather brave study, penicillin versus homeopathy for streptococcal sore throat, I would have thought that's unethical, actually, to do that. You're denying treatment of undoubted efficacy. 8 of the 16 were clearly superior, 4 showed a trend, so you've got 12 out of 16. And so basically, probable effectiveness of homeopathy, and that may sound a bit dubious, but actually they only had a 3-point scale. Probable, possible, unlikely. So this is the most positive judgment. And homeopathy is now, along with several other complementary therapies, is now recognized in the Swiss compulsory health insurance. Okay, so now this is EPI 3 again. So they looked at consultation, prescription, and total costs. So the cost to Social Security were less for homeopathy. The cost prescriptions were less for homeopathy. 50%, big difference here. 35% less cost, 50% less cost. The consultations were more expensive, 45% more expensive. And this is the insurance. It's complicated. The French system is a bit complicated because you have bits paid by the patient, bits paid by the insurance, and so on. But the bottom line is that the homeopathic GPs, when you take everything together, were 20% cheaper. So this is just to show you the differences. We can skip over that, I think. So yeah, those are the main differences. This is the one where this is homeopathy is more expensive here, but overall cheaper. So yes, so fewer psychotropic drugs, management less expensive globally, important interest to public health. Those are the bottom lines. This was published last year. Now there's another study, quite recent, done by Claudia Witt, who's a great friend of mine who I have huge respect for, taking large-scale study, taking data from a German health insurance company, which added this integrated care package. They put in an integrated, they gave patients the option of an integrated care contract. They looked at the costs as paid by the insurance company for 12 months before and 18 months after, and actually had a negative result. But let me show you that. So large scale, over 44,000 patients, societal perspective, meaning including sick leave and so on. And it was more expensive. The largest differences were in productivity, but they decreased over time. But we say in research there's 2 kinds of mistakes. One is the one that's too small to be seen, and the other one is it's too big to see. And I think the problem here was too big to see. So this is just to show you, let's skip that one. Okay, so this is to show you what happened. So this is the 12 months before they started, and this is when they got the integrated care. So what happens? Well, patients avail themselves. They're offered homeopathy, they avail themselves of it. What do you expect? What it tells you, I think, is, if you look back here, where are we? So here. So it's allergic rhinitis, headache. These are the most common things. What it tells you is there's a huge amount of low-grade suffering around. Patients don't want to take SSRIs. They don't want to take non-steroidals for very good reason. So when they're offered the option, of course, they take advantage of it. I have to say, this does seem to me, blindingly obvious. So quite, but they interpret it negatively. Big increase in the number of diagnoses. But patients just took advantage of being able to see a homeopath. That's what the problem was. Let's skip over this one. Right. So now the infamous randomized controlled trials. As of August this year, there were over 11,000 clinical trials of homeopathy. You can very easily verify for that yourself from the Carsten Stiftung, also done with the collaboration of the HRI, something called CoreHom. Carstens, by the way, Karl Carstens was the president of West Germany in the 1970s. He's a serious guy. including 483 randomized controlled trials, 41% positive, 54% were underpowered basically, 5% were negative, and actually this number is very similar to what you find if you look at all clinical trials of conventional medicine. There are a lot that are underpowered, that are inconclusive. Just to quickly look at them, so these are all the trials of the whole of homeopathy. Interestingly, in the Australian report that Rachel was talking about earlier on, they quoted this one 26 times. They didn't quote the conclusions of any other single, and half of it actually, half, they quoted 26 times half the conclusion of that one. They didn't quote any other single one, because the second half of the conclusion says, but when you correct it for quality, it's not, they say, overall the evidence is positive, but when you correct it for quality, it isn't so positive. And that's the second half that they quoted. 26 times, I counted it. These are specific areas. So this is clearly positive, probably positive, inconclusive, tentatively negative, and clearly negative. Our friend Ernst appears here. Although actually you'll find him over here as well in a moment. Where is he? He does appear over here. Here he is again. But here he is, you know, being more positive. Anyway, just to show you, this is the work of Robert Matthey. You know, there are actually a large number of clinical trials, and a lot of them, you know, are positive, or at least show positive trends. So this is Robert's work, looking at done with by a very prestigious centre at Glasgow University, statisticians, 32 randomized controlled trials for 24 medical conditions, and they looked at them in terms of quality. And what you get is here. So here they all are. So this is, so here they are. So this is increasing quality. As you go down, they increase the quality. So what you see is that they remain positive. So this means that there's no difference between placebo. This side means positive homeopathy. This side would mean negative homeopathy. As you can see, not one of them falls on the negative side. And the mean, actually, very unusually, with increasing quality, moves to the right. Normally you would expect it to move to the left. The high quality studies are less positive. But this is down to only 3 studies actually, so the confidence intervals are wide, but the mean is actually moving to the right with improving quality. This is just one of the one of the 3 high quality studies, Iris Bell's work on fibromyalgia. Let's skip through that. This is David Riley's work that we were talking about, that Rachel mentioned briefly earlier. Just to show you, this is the synthesis. So this was the pilot study. These are the subjective values. These are the objective values. You can pool the subjective values because just visual analog scores. And as you can see, they were all positive, and the pooled result is positive. And also the objective measures were always more positive for homeopathy, for the isopathy, than for the placebo. Quickly, biological models. This is rather a nice, simple model that's easy to understand, good one to explain, you know, to journalists. This is the so-called light-dark test. This is a standard screening test used in the pharmaceutical industry for anxiolytics. And based on the fact that mice are timid creatures, if you put a mouse in a cage with a light and a dark compartment, it will tend to spend its time in the dark compartment. And anxiolytics increase the amount of time it spends outside the dark compartment, and also the number of times it goes in and out from one to the other. And you just track that with automatic. You know, you just have a camera, an automated camera, and it just tracks how often the mouse is going in and out and how long it's spending out in the light compartment. So this is gelsemium, including high dilutions of gelsemium, versus the conventional anxiolytic buspirone. And as you can see, it is actually more effective in this. So this is the time spent in the lit area. This is the number of transitions between the compartments. As you can see, the gelsemium is at least as effective, possibly more effective than buspirone in this method. And if you carve up the brains of these poor rats, you can find differences in the neurosteroids in their brains. This is a nice study. This one has possibly, you know, big practical implications. Hypericum in transected rat sciatic nerves, not very nice, but I think you could justify this because of the importance. So they cut the nerve and they put the ends in cut tubes, or they just cut the skin and didn't even cut the nerve. And then the ones with the cut nerves they treated either with hypericum 30C or with placebo. And this is one of the, this is the mean axonal diameter. This is the placebo untreated. This is where they didn't cut the nerve at all. And this is the hypericum group. Big difference. Done by a guy called Rahim Mohammadi, who is Iranian. He's now back in Tehran. I didn't even know there was homeopathy in Tehran, in Iran until quite recently. He was actually in Canada when he did this. And then this one is, I rather like this one. This is a recent thing from the Baumgartner group in Switzerland, using essentially what is essentially sensitive crystallization. I used to get sent a lot of papers on sensitive crystallization for the journal, and I thought, oh, this is just hippy-dippy stuff. What you do is you get a supersaturated solution of something like copper sulfate, and you drop your sample into it, and you get this, it immediately crystallizes, and you get these pretty patterns. And they used to claim, oh, we can tell what's been put in there. I thought, oh, yeah, very pretty, but I don't believe it. However, I'm now a believer. So this is done by, so what they did is they looked at the crystalline structures from evaporating drops of biological fluids and what they did is they took droplets which evaporated from wheat seedlings and then looked at what happened when they crystallized them, and stressed and non-stressed. Very important. It has to be these, very often you find that these effects simply don't happen in a non-stressed system. You have to have a stressed, sensitized system. So what they showed is differences in, this is the fractal dimension. I'll show what it means exactly, but the basics, the fractal dimension of the stress seeds, and it reduces the complexity only in the stress seeds, in the seeds that they had heated. So that's just to show it, the crystalline structures you get. That is the one you look, this is the treated stressed seed. So you can see there is a big difference. So this is the unstressed, you can see there's no difference. Here, that is apparently the same as that. That obviously is the same. But here, using this software, image analysis software, they can show a difference in the fractal dimension. And so this is water being transpired by stress-treated seeds. And just finally to wind up, nice high-tech study done by Paolo Bellaviti in Verona in Italy, showing that arnica, so this is using PCR, a reverse transcriptase polymerase chain reaction, looking at the gene expression in macrophages. And what they have, so that's just to show you, so they treat arnica, normal macrophages, and activated macrophages. Again, normal macrophages, nothing much happens. In the activated macrophages, they transform into the wound healing, wound healing IL-4 phenotype. So the stressed ones change from the macrophage that's involved in infection to the one that is more involved in wound healing. That just shows these particular chemokines are more expressed when you treat these macrophages with arnica. Just to show you, this is just at 2 different time points, but to show you the difference in the regulation of this particular gene, the CXCL3, which is involved in wound healing. So, but they must be stressed, okay? Modifies key regulators of tissue remodeling and inflammation and chemotaxis. So just to finish off, just to summarize, patients who use homeopathy are more highly educated and tend to have a healthier lifestyle. Clinical effectiveness studies show better results in routine practice. I didn't actually show you that slide, but I could have done. Better equivalent results with fewer harmful drugs. Health technology assessment is positive. Economic analysis is variable. The EPI3 was positive. The German study was negative, but had a big flaw. The RCTs over 1,100 clinical trials, nearly 500 randomized controlled trials, 44 systematic reviews. Meta-analyses are mostly positive, particularly in the areas of allergen, your upper respiratory tract infections. And the very last one, animal models, mouse regeneration, nerve regeneration, mouse anxiety, the light-dark test, the droplet crystallization, and the PCR. All of them, none of them work unless you have a stressed or pre-sensitized system. Thank you. Sorry, a bit of a rush.